By the end of November 2010, nearly 1,000 infants, children, and adults in San Diego County tested positive for whooping cough. More than half of them had been immunized. Our investigation shows that trend continues throughout California. KPBS and the Watchdog Institute collected data from 9 California counties that report some of the highest infection rates. Our research shows that where immunization history is known, between 44 and 83% of people diagnosed with whooping cough were vaccinated. We looked at California Department of Public Health records, too. In cases where vaccination history was recorded, more than 80% of infected people had been immunized.
And iNews's investigative reporter Joanne Farian is here with more. And Joanne, you raised questions about whether the vaccine was working back in 2010. Back then, what did you hear from doctors and public health officials?
Well, actually, back then, what we were told is there's nothing wrong with the vaccine. We heard that from state officials. We heard that from the Centers for Disease Control, and in fact, heard that the vaccine had an efficacy rate of somewhere upwards of 75–85%. Fast forward 4 years, and now what we're learning from a lot of scientific study, research that's been published, in fact, there is something concerning about the efficacy of this vaccine.
What do we know about it as far as either now or from what you've learned over the past few years? Why doesn't it seem to be protecting people?
There's a couple of things. So first of all, this is a relatively new vaccine. It was developed in the mid-90s, around 96, 97, because there were concerns about side effects from the previous vaccine, which was called like a whole cell vaccine. So we switched over to this acellular vaccine. So now there are concerns that perhaps this newer, safer vaccine may not be as effective. A second thing that our documentary, the second question it posed, there's research out there primarily coming from the Netherlands that talks about whether or not, in fact, it's a bacteria that causes pertussis, whether or not this pertussis, which is whooping cough, whether or not this is mutating, whether or not it's become a more virulent strain. So perhaps it's those two things combined that's sort of doing what it's doing.
As a scientific community, is there anything being done to improve the effectiveness of this vaccine?
Well, that was something in 2010 we really took a hard look at. And in fact, there was nothing really being done because what we learned are basically the people who make the vaccine are also people who are on lots of the boards and the deciders, if you will, of what vaccine we're going to use and how often we're going to be immunized. Developing a vaccine takes a lot of time and a lot of money, and it's not until really now in the last couple of years that we're actually seeing people say, hey, maybe we need a new vaccine.
You also, I know, took a look very closely at who was actually getting pertussis or whooping cough in San Diego. What did you find there?
Well, really, we're seeing school-age kids, right? It's kids who are in close quarters together. They're coughing, they're sneezing, they're doing all of this sort of thing. It's a highly contagious illness, and so that's when you put a lot of kids together in a school, you end up with the illness being passed along.
Why do you think, or I should ask you, are things different as far as this spike compared to 2010?
Here's the biggest difference. We're not seeing infants dying. In 2010, 10 babies died, 2 from San Diego County because of this illness. Doctors were caught off guard. In fact, babies are the most really at risk, babies less than 6 months old. If a doctor recognizes early on this is pertussis, that baby can get antibiotics. What happened in 2010, doctors were being caught off guard. This was a disease that really we hadn't heard much about until this epidemic. Now what we're seeing, a lot of people getting this, but they're not getting as sick because they're immunized. And we're seeing infants, even though they're getting it, we had 35 infants in the county, there, no deaths because of this.
They're recognizing it earlier. All right, iNewsSource investigative reporter Joanne Farian, thanks so much for the update.